Well, thank you, Chair DeGette. I want to thank you as well for calling this hearing on the public health epidemic that is the opioid crisis. And thanks to all of you, all of our expert witnesses, for everything that you're doing to help families deal with the dire consequences. In Florida, the past few years, we've lost well over 5,000 of our neighbors per year. And while I'm really proud of the work of this committee passing 21st Century Cures and the Comprehensive Addiction and Recovery Act and the Support Act, there is one glaring problem that has been highlighted by a few of my colleagues here today, and that's the lack of continuity of care and resources in the minority of states that have not expanded Medicaid. And unfortunately, the state of Florida is one of those. Mr. Kinsley, North Carolina has not expanded Medicaid. I believe all of the other states have here today: Pennsylvania, Massachusetts, West Virginia, Rhode Island. In your written testimony, you noted that, quote, for every single person who is brought to the emergency department, nearly half has no health insurance at all. Further, you stated that expanding Medicaid, quote, would bring an additional $4 billion into North Carolina for health care. All of the Democratic members of the Florida congressional delegation yesterday sent a letter back home. It's the opening day of the Florida legislature. And our message to the governor and to members back in Florida was that you're not doing right by our citizens. One recent study said if Florida expanded Medicaid, we would draw down almost $14 billion for our state over the next 5 years alone. It would improve people's health, it would improve people's access to health care, and it would do so much for families who suffer the consequences of substance use disorder. Mr. Kinsley, talk to us again about how expanding Medicaid in North Carolina would allow the state to better target the use of federal grant dollars to address the opioid epidemic.
Thank you for the question, Congresswoman. At present, more than 2/3 of the federal state opioid response and state targeted response grants that North Carolina receives is just going for treatment for expanding care for the individuals that are uninsured. And that is a laudable and notable purpose for those dollars, but we do not have those dollars available to building our workforce, to training our individuals, to increasing the way that our system works together and coordinates care. Instead, we are expanding treatment because we do not have Medicaid expansion in North Carolina. The North Carolina State Legislature reopened and reconvened today around a budget that has not been able to be passed, primarily in the debate of Medicaid expansion in North Carolina. And I too hope that we are able to expand and increase access in North Carolina.
Other recent studies have shown that now 37 states plus the District of Columbia have expanded. The other states that haven't, we're sending our dollars to and subsidizing the budgets and health care of citizens of other states. Congressman Castor wants to take me to lunch for this something. Ms. Smith, how many lives have you saved in Pennsylvania because Pennsylvania expanded Medicaid?
So in Pennsylvania, as a result of Medicaid expansion, we've been able to treat about 125,000 additional patients. So for us, that's huge. I can tell you, with the large amount of funding, over $230 million coming to the state, if we did not have Medicaid expansion, you would not be hearing me talking about a loan repayment program, about housing, about expanding MAT and corrections, about any of those things. Because the reality is that we would be spending all of those dollars just on, I'll call it plain old treatment. So as a result of Medicaid expansion, we've been able to repurpose those dollars in ways that allow us to modernize the system, to integrate with physical health, mental health, behavioral health all together in one system moving forward. So I really can't stress enough the importance of having participated in Medicaid expansion, and certainly hope that it continues for years to come.
Burrell, how about you in Massachusetts?
In Massachusetts, the foundation of our treatment is having access to the medical treatment that is proven and evidence-based. Because we have that, we have been able to tackle the very challenging and complex issues related to getting individuals to that care, preventing disease in the first place, making sure that individuals who are at highest risk not only obtain that cane, but stay in that with recovery coaching, which is, by the way, covered by our Medicaid 1115 waiver now.
And thank you. And Ms. Mullins, West Virginia, I believe, has the highest share of population served through Medicaid. And you talked about the importance of predictability. How important has Medicaid expansion been to opioid and substance use treatment? You talked about the predictability of care and the predictability of those resources.
It's very important in terms of sustaining. I talked about the infrastructure that we've been building. Without Medicaid paying for residential treatment, there is no way to sustain those valuable services. And according to my notes, we have over 21,000 West Virginians receiving medication-assisted treatment in our state.
Thank you very much.